Hi, this is Jovan, and I am doing the SubQ and intramuscular video. I will be administering my subcutaneous injection via the abdomen, although I can also do it in the upper arms and also in the anterior thighs. For the intramuscular, I'll be administering that via the deltoid, but you can also do that with ventrogluteal or vastus lateralis as well. So the first thing I'm going to do, sanitize my hands, go to the MAR, and I'm going to check. My patient is Oscar Simpson. Date of birth is 11/11/36. His allergies is pollen and codeine. And I'm going to go ahead and see what we have here. He has an order for to administer epinephrine, 0.5 milligrams as needed via subcutaneous route, starting today and now. The second thing that I need to administer is going to be the influenza vaccine. That's 0.5 milliliters one time via the intramuscular route, also for today and now as well. So I have gone ahead and verified that the chart and that the orders are correct from the healthcare provider. So now that I've gone ahead and I have verified that, I'm going to go ahead and go to the medicine cart. Here it is. I'm pulling my epinephrine. My epinephrine that I have here. Go down here back. Epinephrine. My epinephrine that I have here, okay, 0.5 milligrams. I have 1 milligram, no conversion is needed. It's, again, Oscar Simpson, subcutaneous route as needed. And this expires on February of 29. So there's my first one. My second one is going to be the influenza vaccine. So we're going to go to that. Pull that. Let's go ahead and verify that. Here I have 2 milliliters. Again, no conversion is needed. This expires October of 29. 0.5 milliliters, one time via intramuscular route, starting today and now. And again, this is for Oscar Simpson. Okay, so I'm going to go ahead and gather all my belongings that I'm going to need. So for the epinephrine, I'm going to need the filter straw. I'm going to need the needle, 5/8 inch, 25 gauge needle, and a 1 milliliter syringe to administer that. For the influenza vaccination, I am going to need a 1 inch, 22 gauge syringe for that. I'm also going to need some gauze, alcohol, perhaps, and of course my gloves. So before I go ahead and I make my medication, I want to make sure that I have all of the information I need for the patient of any type of side effects that come with the flu vaccine, and also from epinephrine, so I can go ahead and give him that literature. And now I'm going to go ahead and verify this one last time before I make it. Here we go. Epinephrine, 0.5 milligrams subcutaneous, starting today and now. Okay. And influenza vaccination. That is going to be 0.5 milliliters one time via intramuscular, and this is for Oscar Simpson. So I'm going to go ahead, clean my hand one more time. Okay, holding this up, we're going to go ahead and pull this away. All right, leave that flat there. We'll throw this in the sharps. Okay, and I'm going to go ahead and take out my syringe. Want to make sure without touching anything. Okay. I'm going to take a little more than 0.5. Okay. And then I'm going to go ahead and take this off. Throw it in the sharps, and then I'm going to pull the correct needle to administer this. All right, so I'm going to make sure I don't have any bubbles. Okay, see that? And then we're going to go ahead and push this up to make sure there I see the bubble. Get it to the top there. And we're at 0.5. Okay, so there's one. All right. And I'm gonna put this inside the sharps. All right, there's one that's ready. The second one is going to be my influenza. We're gonna clean the top. Make sure that that's nice and clean. Okay, leave that there. Okay. And we're gonna pull this all the way back. Let's put it right there. Okay, we're gonna do rainbow. Leave this at the edge so I can scoop that up. And I'm gonna go ahead, put the air in, flip this upside down, and then we're gonna pull back. We only need a half, so we don't need that much. All right. So again, we wanna make sure, okay, the bubble's at the top, so we're gonna go ahead, just make sure. Oh, that went everywhere. All right, there's my half. And we're gonna go ahead and scoop this back in. All right, so that's done. I'm gonna clean my hands, make sure that's good. I've done my verification twice with the mark. We'll verify one third time when we get into the room. Make sure that I have everything that I need with me. And here we go. Hello, my name is Giovanna. I'm gonna be your student nurse today. May I verify your name and date of birth, please? Oscar Simpson, 11/11. 11/11/36. And any allergies? Yes, pollen and codeine. Well, happy birthday. Let's go ahead and verify your wristband. Yep, I see that. Okay, well, we won't be giving you codeine today, but what we will be doing is giving you an injection, the subcutaneous injection for your epinephrine. And also your doctor has ordered the flu vaccine so that you don't, hopefully it will help you from not getting the flu this season. So have you ever gotten this before? Yes. Did you ever have a reaction? No? Okay, perfect. So bed is in the lowest position. Wheels are locked. Mr. Simpson has the call light and there is no clutter around him. So now that he has all that, I'm going to go ahead and provide the privacy curtain. Okay. Before I administer this medication to you, I just wanted to give you a little background for the flu vaccine. I'm going to be administering that in your deltoid. So you may have a little localized swelling or soreness there, a little fever, maybe even a knot, some pain and some fatigue. Just know that these are common side effects and hopefully that this will help you from contracting the flu this season. Also with the epinephrine, I know you've had this before, but just wanted to let you know that if you feel any restlessness, nervousness, if your heart's beating a little faster, or even if you have a little bit of higher blood pressure, these are all common side effects when you have epinephrine. However, if you do have any difficulty breathing, any wheezing, hit that call light so I can come in here because that is not a common side effect. So I definitely want to make sure that we get in here quick enough. Okay, so, all right, I'm going to go ahead, clean my hands. Okay, I'm going to go ahead and put my gloves on. And we're going to go ahead and verify one last time that you have right here, influenza, 0.5 milliliters. And we're going to be giving that to you once via the intramuscular route for Mr. Oscar Simpson. And we also have here our epinephrine, 0.5 milligrams, giving subcutaneous as needed. Okay. So we're gonna go ahead. Which one do you want first? Is it okay if I raise this up? Okay, great. Go ahead and just clean you up here. Make sure you're nice and clean. And I'm gonna leave that there so I know. All right. Okay, I'm gonna remove that. Squeeze, 1, 2, 3. All right. And okay, typically we would put the safety, but because we're saving these, we're going to go ahead and put it back inside the clip. Okay, and then that will go into the sharps. All right, and then we're going to put the gauze on there. All right, are you feeling you okay? Any burning? No, you're good. All right, let's see. All right, looks good. So we'll go ahead and put this down for you, okay? All right, round 2. I'm gonna go ahead and do that in the upper deltoid there. Go ahead and get this nice and clean. I'm gonna leave that there. Okay. Once again. All right, and I'm gonna spread the skin so it's nice and taut. Ready? 1, 2, 3. All right. There we go. Hold that down. And once again, typically we would put the safety on, but because we are saving these things, we're gonna go ahead and put this here. Put that in the sharps. All right, leave that there. Okay, no bleeding. Any burning? You feel okay? All right, wonderful. Okay. Do you have any questions for me, Mr. Simpson? No? Okay. So I'm gonna go ahead, clean my hands. Bed is still in the lowest position. Wheels are locked. He does have his call light. He is all good to go. All right, Mr. Simpson, I will be back in 1 hour to check on you. If you need anything, please let me know, okay? I'm gonna come over here to my, to pull up the MAR, and I'm gonna document that I've administered both of these medications, epinephrine via subcutaneous 0.5 milligrams, and I have also administered the influenza vaccination, 0.5 milliliters, one time via the intramuscular route, and that he had no side effects as of right now, and everything is fine. So now that everything has been documented and it has been administered, I'm gonna go ahead and clean my hands, open up the curtain. All right, I'll be back in 1 hour to check on you, okay? Great, thank you. End of my video.